Everybody, it's good to see everybody, or most of you anyway. We have a great presentation this morning, and I just want to give some ground rules that if you wouldn't mind keeping everyone on mute during the presentation. And if anybody has any questions, please put them into the chat box and we'll review them at the end of the presentation and answer them the way they came in. We're also going to record this for the notes, and maybe we get this back, get the presentation back out for those who were not able to join us today. So thanks everybody for joining us, and I'll turn it over to Marshall.
Great. Thanks, Dave. Good morning, everyone. I think I'll start with just a brief update on Kathleen. I know many of you have seen her post on Facebook. She is recovering from surgery. She's rehabbing at home, working very hard on recovery. And in her own words, she's looking forward to seeing everyone at the next merchant meeting on the high holy day of my people,
Howdy.
March 17th. So we actually talked with her at our team meeting yesterday. She's in good spirits. She is in some pain, but she said it's getting better
Put this on mute
every day.
so I don't.
But at least she's at home, surrounded by loved ones.
So when they do the presentation,
folks are checking in on her all the time. So I will be sure to send her our regards, everyone here. But yeah, please continue to send your well wishes and everything via Facebook, because as much as we tell her to relax, she's still all over Facebook. So with that, we're going to move on to our program today. And I know that you all are well aware of the work that's been going on behind the scenes and now more in front of the scenes with getting our community vaccinated. We know the best thing that we can do for the economic and personal health of our community is to get everyone vaccinated, and having that done in a cohesive and well-planned way. Lancaster General, who is one of Lancaster City Alliance's legacy partners, has been really at the forefront of this effort, working very closely with the county, other hospitals, business community. So we're so pleased to have representation from LG here to update the merchant community on where we are in this very, very, very important initiative. Dr. Rapinski was originally going to be here today, but as you've probably seen in the news, he has been front and center in planning for the mass vaccination site. So he is actually going to be at the county commissioners for final approval today to move that forward. But rest assured, his able colleague, Judi Brendle, who is LG's Chief Nursing Officer, is here to step in and provide an update this morning. So thank you, Judi, for joining us. And if everyone could help me welcome Judi, I will turn it over to her.
All right, thank you very much. I just want to clarify, I was the Chief Nursing Officer in the past. I'm now doing consulting work, which is actually leading me to my introduction when I got a phone call from LG Health to take on this project. It's something very near and dear to my heart. My in-laws had COVID in June. My father-in-law passed away from COVID. Both my parents had COVID. My dad had a 3-week stay in the ICU at LGH. And I've had several friends and colleagues with the disease, and actually had a friend just pass away on Sunday from the disease. So, this is a project that I truly believe in, and I feel so privileged to be part of it. So I'm going to start with the presentation. Can everybody see it? Okay, perfect. All right, so stealing Mike's presentation here. And if I can. Okay. So what we're going to review today includes the current state of COVID-19 infections and vaccinations in Lancaster County. I'm going to explain how the vaccination works and trying to get rid of any fears related to it, and the confidence in the science that helped create it. And actually Penn Medicine was a significant part of that piece. And then obviously questions and answer session with me and not Mike. All right, so new COVID-19 cases by date in Lancaster County. So you can see the rapid incline that it took over month by month within our area. And we're still rising, so we're not going down yet. So it's a slight increase, but we're still remaining at a high level. And part of this is related to several days of results of antigen testing kind of getting clumped together in an unusually high daily total, but we are having more people tested and the tests are coming out positive. And most of this information was updated that we could get the latest from in February. So our incident rate per 100,000 people, I know this is it might be difficult on some of your screens to see, but you can certainly see the areas of hotter spots than others within. But compared to last week, we increased up 246.1 compared to Pennsylvania overall. So again, it's just showing that in Lancaster County, we still remain at a high level and higher than the state of Pennsylvania overall. So this is really a significant issue for our county and community. So percentage of positive tests at Lancaster General Health, and this is a 7-day moving average. We are down 9.9%, which is great, except we're still higher than compared to Pennsylvania overall. So really showing our high volume of people testing positive within our community. And as you know, a lot of this still, there's a lot of controversy about masks out there, but social distancing and masks is still, the best way to prevent this from occurring. We have a wide variety of community members. Some of our faith-based communities don't believe in wearing the masks. They're being taxied by people who might be wearing the mask or may not because of their comfort level. They feel like they know them. And so they don't wear their mask thinking they're going to be okay. And not everybody has a significant health issue when they get COVID as well. So the symptoms can be very minor, and you're also symptomatic. You also can spread it before you're symptomatic as well. So, it's really hard to tell if you're around somebody who has COVID or doesn't. Symptoms aren't always there. So our average daily hospitalizations in Lancaster County are for us are 87.9. The number of COVID patients in Lancaster County decreased. So it is great that we are decreasing from last week, but we still have a high amount of patients on ventilators. Even though that has decreased as well, we're still at 10. And the whole goal is to try to prevent somebody with the high flow oxygen to not get on a ventilator. But sometimes that can't be helped. Hospitalizations provide a measure of the severity of the COVID-19 disease. And it really shows us how the pandemic is impacting the healthcare system. So not only we're in constant contact with our other healthcare partners of Penn State, UPMC, and WellSpan, and we are all going through a very difficult time with taking care of our patients and and just supporting our community. So the other thing, the most important piece about this slide that I'm showing you is we have a high rate of people in our community traveling to non-essential businesses. So the great news is that we are decreased from before, but as you look at us compared to Berks County, Chester County, and Dauphin County, we're still higher than those areas. Good news compared to Lebanon and York, they are also down as well, but we are still traveling to places that we probably shouldn't be going to. And that puts us at higher, those community members put us at higher risk to spread the COVID-19 disease. And as I'm sure if you're traveling the Pennsylvania Turnpike, even to stay within internally, you're seeing signs of, how long you need to quarantine and so forth. So in relationship to vaccines, right now, according to how it is laid out for eligibility, we have more than 200,000 members in our community that are eligible for the vaccine, which is awesome. So this includes long-term care facility residents, healthcare personnel, persons not directly involved in patient care, but they are exposed to infectious material that has the potential of transmitting the disease. So this can include positions like this can include people like undertakers and, you know, a multitude of other roles as well. And then also persons ages 65 and older, and then ages 16 to 64 with high risk conditions, and they are listed out there for you as well. So here is our Pennsylvania Department of Health vaccine data. So right now there's about 1.7 million doses out of 2.3 that are administered. We have Lancaster highlighted because you can see the disparity when you look at the total numbers, how many people that we have vaccinated. And it's certainly not due to the fact that we don't want to vaccinate people. It's the amount of vaccines that our community is getting overall, which is a significant issue. In the far right column, you can see Lancaster is highlighted. That the partially covered means they got their first injection. The fully covered means that they got their second injection as well. And this is just a great indication of why we need this mass vaccination center overall. So I'd like to talk a little bit about the history and function of the mRNA vaccines. You might know them better from Mrna and the Pfizer product that's out there. So they were those are the only two that are available right now. There's still controversy about when the Johnson & Johnson vaccine is going to be available. If any of you have recently watched the news, you may have seen that they are now talking July that it might be available. So this is what we have out there as well. And both of them have about 95% rate of preventing COVID from occurring. So there is a chance that people could still have this vaccine and obtain COVID as well, but it's, you know, pretty high, and it's the best that we have right now. So messenger RNA is actually a synthetic RNA that they put in lipids. And the goal of this is that when it's injected into your body, that it spikes our proteins, and that it can then cover the surface of this synthetic RNA and then start building up and preventing us from getting COVID-19. So it's kind of like a slow introduction to it, gets our body used to it to build up the immunity that we need to have to prevent it from occurring. So pretty much your first injection takes about 12 days until it really starts having an effective result, that you're starting to build the immunity. And then Pfizer is another shot around 21 to 28 days, and Mrna is 28 days later to another 7 to 14 days as well. There is no live virus involved in this, so want to be very clear about that. And so it is a very safe, this technology of building this kind of synthetic RNA was actually developed by Dr. Drew Weissman about 10 or 12 years ago. So it actually has been around a long time. And that's why it was able to be created so quickly, and that we didn't have to wait for years and years of study because it was done in other avenues. So the only absolute contraindication to these vaccines is actually related to the other components that are in, that make up the vaccine. So the most significant one is polyethylene glycol, and that is an ingredient in some other medications. But if you already have an allergic reaction, you would have had an allergic reaction to those medications as well. But there are a lot of side effects, so you know, don't want to pretend that they aren't. Most people within the first injection, they're mainly talking about soreness at the site, and that can last for several days. And that soreness may actually require something like Tylenol or Advil for you to get through. Might be difficult for you to use your arm for a little bit day, not every day, but for a few days, but that's not for everybody. You can also have redness and swelling, and you can also have some lymph node swelling, but that's really rare. More so seen in the second reaction with the medication or the vaccination is fatigue, muscle aches, headache, chills, joint pain, fever. I personally, I've had my first injection. I can tell you I had arm soreness. I did not have any other reactions, and I don't get my second injection for for another week yet. And again, symptoms can be worse after the second dose, and the symptoms are less severe in people over age 65. And the good news is, though, these symptoms are actually reflective of that your body is responding appropriately to the vaccine and starting to develop that immunity. So, which is really good. We do sometimes see an anaphylactic reaction. At Lancaster General, we're seeing what is being seen across the country, 1 to 2 cases for 16,000 people. So that's why we have emergency response plans to deal with that. And our response to the 2 people that we've had led into success, and the people have done very well. So the Community Vaccination Center. So this is a broad community engagement. Penn Medicine is the managing partner, and we are partnered with the county agencies and commissioners. We are also partnered with the Lancaster City and County Medical Society, UPMC Lidditz, WellSpan Ephrata, and also Penn State. So as you all know by now, this is going to be located at the Bonton. It can accommodate actually more than 6,000 people a day. And we're going to be able to schedule and register people both online and with a call center. Our call center will be up and running actually before the center is up and running. So we can start scheduling people for people who can't access a computer. And our daily volumes that we do here will definitely depend on a supply of vaccine currently from the Department of Health. We did apply for a FEMA grant and were approved for this community vaccination center. Today, and my partner that I'm working with FEMA, we are putting a request in if we can get vaccines directly from FEMA, because we're having a hard time even sourcing our local hospitals with the vaccine. And there's also been some glitches. This has been a very tough week for both Penn State and Lancaster General. We were both supposed to be getting shipments over the weekend. Lancaster General specifically was to be getting 5,000 vaccines. Where the vaccine was coming from was an ice storm. And because Department of Health is the one who manages it, they sent it back to the manufacturer. So instead of getting our vaccines on Saturday, and we thought we made plans to get them on Monday, they were shipped back to the manufacturer. We're expecting to get them today. So we cobbled internal resources to cover our large vaccination center at the health campus. And then Tuesday, we had to cancel almost 700 appointments because we could not get vaccine to cover Tuesday. Wednesday, we were able to work within the Penn Medicine Health System to cover that, but obviously we're going to have to pay back everybody that we borrowed from. So, you know, it just has now put us behind instead of ahead of the game. Penn State did not share what their volume was, but it affected 2 of their hospitals. So that's a really big deal for Pennsylvania overall, and it's a big deal for Lancaster County. And because we have had an enormous response from the community with our positions on TriStar, we can easily staff that we can accommodate 6,000 patients a day, and that's our goal overall. So Dr. Ripchinsky also is working very closely with our local government and the commissioners, also with contacts directly at the Department of Health of, you need to give us our vaccines. And we are hitting the goals of getting 80% vaccinated of the vaccines given to us within a week. So we definitely can get this done. So in March, when we open the Mass Center, we will be having not 6,000 patients a day. We're going to start out smaller, between 1,000 and 2,000, just to make sure we have our flow down, can work the kinks out, because we want to be able to keep people moving simply through the system overall. But our goal is by March 15th that we will be at 6,000 a day if we have the vaccines to move forward. And again, we're using FEMA and CARES Act funding. And so we're working very closely with the government on both of those to make that happen. So the biggest thing that you can do to help us is to talk about that there are phases of how we can administer the vaccine. So, you know, right now it's the 65 and older population with the most comorbidities. What people are doing around the country and including our local county is we're looking at the, you know, our oldest population with the highest comorbidities and working our way down from there. And we will be updating our phone lines and our websites, and also vaccinatelancaster.org will also be updated with when people can schedule for what types of vaccines. There will also be, besides the individual hospitals, there will be a community-based way to sign up, and that's directly related to our mass vaccination center. So community members will have two ways to sign up, one through their local hospital and then also through the mass site, because we want to just give as many injections everywhere that we possibly can. You also want to educate yourself about the science and the efficiency or efficacy behind the vaccines. So I have to tell you, you know, another self-story is my mother, after receiving the flu vaccine in the early 90s, developed Guillain-Barré, which is a paralyzing disease that can or cannot reverse. She was lucky enough to reverse. My mother did not want to get this vaccine and had to have multiple conversations, but my mom has had the vaccine, no side effects. And so, you know, you might have people who know people from the flu vaccine, and so they're scared and worried. And just vaccines in general sometimes scare people. But it is a lot safer than getting COVID because you don't know how your body's going to respond when you do get COVID. And then help manage your employees' expectations. So calling their primary care physicians or pharmacies won't get them vaccinated any sooner. And in fact, most places are shifting a lot of the vaccines from pharmacies because they can't get the volume out. And if you think about it, they're managing medications, they have very tight staffing, and to pull extra staffing to just give injections all day long is very difficult. So most places outside of healthcare systems are only giving 10 vaccines a day. And because the health system has been able to prove, not only in Lancaster County, but again, across Pennsylvania, that we can give them much more efficiently, is that they're being refocused to them. So we are so happy for our partners. I want to be very clear for that. But you know, it's not making sense if they're only getting out 5 or 10% of their supply a week, and we're getting out 80% of why they're getting the same amount that maybe a hospital is as well. And it's going to take a long time for us to vaccinate Lancaster County. Everybody wants vaccinated. And we see that because we are all overwhelmed. Every hospital that I mentioned to you, there are more people calling and asking to get vaccinated, and our schedules fill up quickly. As soon as we release appointments, they are filled up typically within 24 hours or less. And so there is a high demand, and that's the same across the United States. So the manufacturers are producing as fast as they can, but we can only do it as fast as we get the vaccine as well. And as that, if we have a consistent way of getting our vaccine so it doesn't get stuck in an ice storm or get sent back, you know, and I'm sure this was a lesson learned also for the state overall. All right, that's the end of my presentation. So I'm definitely open for questions or concerns or anything that I can do to assist any of you on the line.
Judi, thank you so much. This was like very helpful, very informative. So yes, we would well, we have the opportunity to have Judi here. Would love to entertain any questions, comments. Feel free to raise your hand or put something in the chat box. Gary.
Can you tell me what makes the Johnson & Johnson vaccine different?
It actually is a totally different configuration. So the history behind it is not as long-standing, and so they are still going through testing phases. So there have been some glitches within developing it. You know, if and when it does come through, the efficacy is actually supposed to be greater, and it's only one shot. So I don't want anybody to be scared about that as well, but it's still actually in the development phases. There is some of it that is being developed that has some history behind it, but still moving forward.
Sandy?
Yes, Judy, I've read some conflicting information. In people that are younger than 65, is high blood pressure a pre-existing condition that would allow somebody to be in the phase 1A or not?
Typically just blood pressure alone will not put somebody in that age group because it's only one comorbidity. If they have other things besides that, that could bump them up. Now, obviously, having high blood pressure with somebody of the same age who has no health conditions, that will bump them up before that other person.
Okay, gotcha. Thank you.
You know, because we have some pediatric patients that have a lot of health conditions going on, and you know, we're trying to work on how we get our hands on Pfizer, because they really do need to be vaccinated sooner than later, because even though they're very young, because of their multiple comorbidities, they are really at high risk. If they would get COVID, they probably wouldn't survive.
Judy, I don't know if you can see the questions in the chat, but there was one that asked, when will other groups such as shelter employees be able to get vaccinated? So far, they've been told they are not eligible.
You know, Greg, actually, I'd like to get back to you, because that is a high risk population, because you are living in a home situation. So, okay,
Yeah,
I'm sorry, I'm misreading it. So you are in 1A, but
Yeah, and first of all, I want to say thank you to everybody to let me be here today so I don't mean to put you on the spot at all, Judy, but
actually, Greg, from reading your, sorry.
It's just kind of confusing because we've been told we're in 1A, but when I've talked to a few people at the hospital, they're saying that like shelter employees aren't eligible yet to be able to sign up. And I'm sure there's some other groups that land in that 1A, kind of like at the bottom of 1A, but have been told, you know, not yet type of a thing. So a timeline would be awesome, just to know when I could say to our like our healthcare employees have been able to get vaccine at Water Street, for instance, but not our frontline staff who are still at high risk.
Correct. So actually, starting Friday, you and your employees should be looking on health systems websites. Are there phone lines must be available by Friday. What you may find though, Greg, I just want to be totally honest, is when you look at that, you might find a message that there's no appointments available. And the reason why there's no appointments available is that there's no vaccine. But you should be able to sign up either way, because all you need to say is that you're an essential employee, because they are.
Right.
And that's all that's being asked. So some of this is so one is the vaccine shortage, there's no doubt about it. So what most healthcare systems did is they looked in their healthcare systems of who meet this requirement, which is thousands of people. You know, I know at our highest risk population, which was over 80 years old, that gave us 18,000 people for us to vaccinate. We just gave today's Wednesday, on Saturday, it was reported that we finally gave 20,000 vaccines. So if you think about how long we've been giving vaccinations, you know, and we just got to 20,000, and we knew when we even started giving vaccinations that we had 18,000, that just shows the delay overall. And so you might be getting messages that there's no appointments available, but just keep checking back. And that's why we are fighting so hard of asking the state, just, you know, tell us how much we can get, how consistently we can get it, because we're telling you, we absolutely will be able to do 6,000 by March 15th, because we have the people to do it. And we would love to be able to give that many every day.
Right. That matches my personal experience too. Went on several times and then got it. And I know how hard you guys are working. So no fault there, but thank you.
Yep.
So appreciate it.
Don?
This is a great question, Kevin, about so residents better understand their weight. So here's the reality. Not every resident's going to understand their weight, and we understand that. You know, one of the first things that I did when I came on board is I'm like, we have to have a call center. So not only at Lancaster General, but the other partner hospitals, people found other numbers to call, or they know people within the health system and would start just calling numbers at the hospital. And now the whole hospital's answering questions related, when can I get vaccinated? What's the list? So, you know, because that information's out there, it's on the Department of Health website, on vaccinatelancaster.org. There's a link to what the stages are. The healthcare systems have a link related to there, but people just want to be safe and they want the vaccination and they want their life back. You know, they want to travel, they want to be with their grandkids, they want to see, you know, husbands want to see their baby being born. They want to be with their loved one at end of life. They want to see their kids go through a normal graduation. I mean, life has significantly changed. They want it back. So we do spend a lot of time in trying to educate the public, and it's on the news as well. But, you know, people just want the vaccine. So we're trying to educate. I don't think we're ever going to be able to reach everyone. They say you have to hear a message 3 times until you finally understand it. So the more that you can help your employees, the better that's going to be, so people do understand the weight, because even when the vaccine is released, we are required to administer it according to the guidelines that we were given to it. And we can only release appointments as we know we're getting vaccines in. And again, that's for all health systems. It's not unique to us.
Thanks, Judi. John?
Yeah, thanks for this presentation. Do you know, or are you able to project? I know you don't know. Are you able to project when you think 1B will be opened up? And is that something, do you know if that's going to be something that's a county by county decision or a statewide decision?
I think it will be, it will be released for everybody. I do not think it's going to be a county by county decision. That could change. Everything's fluid. Let's all be clear. COVID's been very fluid. But if you remember one of the slides I showed, we had 200,000 residents that qualified for 1A. So we have a long way to go.
Yeah. Okay. Yeah. But right. So I guess if I can ask one more question related to that. So if you're still working through that 200,000, I mean, if it remains a state level decision and the state announces that people can from 1B become eligible, but we're still working through the 200,000, am I hearing you say you're going to take care of those first 200,000 first before you start vaccinating?
Correct, because they're the highest risk. That's why they're the highest risk.
You won't accommodate 1Bs until you know you've meaningfully serviced the 1As.
Right. Correct.
Okay, those are the ones that want it.
Yeah, because nothing would make me happier is if we can get to, I think the volume that we can get through Bonton is actually 6,700.
Yep.
Nothing, that's just there.
Yep.
You know, we're trying to do 1,000, well, around 700 at the health campus, plus our practices. Then you have WellSpan, UPMC, and Penn State, who are also trying to do larger sites as well. So if we can all do what we're planning on doing, but we need the vaccines, that we will actually get through people pretty quickly, and we could be done with vaccinating everybody by August.
Okay, thank you.
Mike Gillette, you had a question?
Yeah, good morning, Judi. Like everyone else, thank you very much. I really appreciate the information. 2 questions for you. You mentioned that there'll be a call center associated with the mass vaccination site, and it will be up and running before the site itself is. Do you know when that's going to be available for people to start calling for appointments?
I do not have a date yet, but what I can tell you, and I'm actually glad the state mandated this for centers that are already running. So UPMC, WellSpan, Lancaster General, Penn State, we have to have a call center related to our health, to our hospital by Friday. And so everybody's phone line will be open by Friday. And we will be publishing before Friday what that number is. And also our website will look a little bit different. But again, I do want to remind everybody, even though these things are up and running, you might be getting a message that we can't make an appointment right now because due to lack of vaccinations.
Okay, thank you. And second question, is there a better time of day to check when vaccines are available? for someone trying to schedule?
So I can tell you, I don't know the answer to that. I know that I know that all the health systems are trying very hard, but we had a call yesterday and one of them did share that their number was leaked early. They got 3,200 phone calls within the first half hour of their line opening up. So I don't know the answer to that. I can tell you if people have access to online, that is going to be your quickest way. But the phone lines will definitely be available as well. And we're going to keep talking about, we have a meeting, I coordinate a meeting twice a week with all the health systems. And we're going to keep talking about the lessons learned and how can we manage these phone lines better as well. So again, this is what I'm talking about. There's a high demand for this vaccine. And it may be somebody who is a very healthy person within the community, but they don't want to have COVID and they just want to get their vaccine. So yeah, we have 500,000 residents within Lancaster County. So I do expect the phone lines will be overwhelmed.
Thank you.
I noticed that everyone got very close to their monitor to hear the answer to that question.
Yeah. And I get it. I get it.
There was a question from Mimi in the chat, considering the new strains or additional vaccines or boosters being considered.
I personally am not aware. I'm sure that that work is going to continue. So there is a base with COVID-19. So I do know that it has a large efficacy, but I do expect that over time there are going to be changes. It's not going to surprise me if this doesn't end up more like the flu vaccine of something we get every year, but that will be much better. If you think about now, when the flu vaccine first started, kind of the same panic went on with that because we couldn't give it in a methodical manner. And we'll be able to give the COVID vaccine in a methodical manner because COVID can happen all year long. There's not going to be a certain time of year. And so they can be scheduled with routine doctor's appointments and so forth. So we're not going to have a mass center every year though to get the COVID vaccine. Great. When that will change, I don't know, but I do suspect that we'll see something like that in the future.
Excellent. David, did I see you had your hand up? You're on mute.
All right. Judy, thank you for your excellent presentation. Really appreciate it. I was extremely fortunate. I received my second dose last Thursday at Lancaster General Health Campus. The staff there was outstanding and excellent, and it was just a great experience. I had just soreness in the site of the injection after both the first and the second dose, very mild to moderate if at most. And so I was even beginning to fear that maybe I got a placebo and not the actual vaccination. So I guess they weren't doing any of that testing anyway. People that have been trying to get in, I say, the best way to do it maybe is just to show up at a site with a cigarette in your mouth, because it sounds like people that are smokers or obese are getting bumped to the head of the line. My question is regarding the efficacy. How, and maybe was this addressed in the last question? Is this good for 3 months, 4 months, a year, 2 years? Do we have any sense yet of how long vaccination is going to be effective?
So actually you will not need a booster related to this injection that you got. If we have to get any other vaccinations in the future, it's because it's based on a new strain.
Okay, great. Thank you.
You're welcome.
Any other questions? Judy, I noticed in one of the earlier slides when you talked about the allotment of doses based on population size. In Lehigh, there were 131,000 doses. The population was, I can't remember the number. It seemed lower.
Yeah, they are actually disproportionate to the rest of the communities, but we've been able to figure that out. So Lehigh Valley has been running flu vaccine clinics for many years. And really what they did, and it's extremely comprehensive, and what they did was tweak their program, connected with the state early on. And because the state was already familiar with their program, they definitely got loaded up with doses first. And they also have been a great partner as we have been developing our plan as well. From some of their great lessons learned. Their biggest site is at Dorney Park, so configured very differently because it's outside. But we also, though, even though they did have this great plan early on, that is one of the things that Dr. Ripchinsky has talked about, though, with the state, because we still have high populations, especially in Lancaster County. We are a high retirement community, and definitely need to get those people vaccinated overall. So Dr. Ripchinsky has definitely been championing for us to be getting more doses, and the disparity in the distribution, because even though they do have a solid process, there's people, you saw the counts, and need to be more equal in how we're distributing those.
So why is Lancaster so deficient in getting, a bigger share, or, in line with everybody else?
I honestly don't know the answer. And actually, Dr. Ripchinsky has also presented directly to the state as well in relationship with that, because it doesn't make sense. For our community, our high retirement community, it doesn't make sense as to why we did not get more share. And I'm not even just speaking for Lancaster General, I'm speaking for all the hospitals within the county.
No doubt.
Yeah, Judi, another thing that I noticed was, I don't know if it was states or counties, but in terms of their phases, it seems that some now are looking at, now it's 65 and over, but they're like 1B is 50, sort of 50 and over, sort of by age brackets. Do you see that as a possibility here, or are there any discussions on, on that?
I don't know how all the classification is going to come out, because again, there are going to be groups that are in a younger age that also have more comorbidities than somebody who's older. So I don't know how the phases are going to be completely rolled out.
Okay.
I have another question, and this might be for you to field too, Marshall, perhaps you, Judi, or anybody else. But what happens when I have a staff of about 25 people, part-time, full-time. It's probably going to be a couple in the bunch that doesn't want to get vaccines. My feeling on it is that masking and distancing really does it. We're really tight about that. So far, so good. So it might be a little bit of a moot point if they don't, although I want everybody to get it. I'm hardcore all about it. I'm hardcore all about masks. I don't tolerate anything other than masks. And what kind of support or guidance or influence in the marketing and whatnot is going to be done to help take some of that burden off of, making the load a little easier for us employers, managers, as in like in the beginning, all throughout, there's a certain group of leaders that did absolutely nothing to support even mask wearing, just throwing the backbone of America under the bus, having to deal with idiocy. So what kind of, is there going to be some kind of like backup punch from, the Alliance or from the hospitals or the health care entities?
Yes.
So I know from our standpoint, we would like everybody vaccinated as well. Just because of all the vaccines that are out there, there are some people who have strong beliefs about not getting vaccines. We all know that. So there is no mandation from the federal government on down that says everybody must be vaccinated. It's recommended. We certainly will always provide education support, because in all honesty, we have a high volume of patients that come in with anxiety. They don't want COVID, but they really don't want the vaccination. And it can add up to 20 extra minutes in the flow of giving vaccines to just deal with their anxiety to get it. And I look at the flu vaccine. I've been getting the flu vaccine for over 30 years now. When it started out, it was voluntary, and then it moved into you need to, if you're a healthcare worker, you need to get everybody, and you need to figure out what policies you're going to have in place related to it. But there's still an out. There's still a way not to get the flu vaccine. So I don't think we're going to vaccinate the entire community, but I would love to see that if we could even get to 95%. And the message is going to be out there. It's going to be available. And sometimes people get a comfort level if they see somebody get the vaccine and really have no complications, or people change their minds if they were affected personally by a loved one or a friend that either had a significant outcome or passed away from the disease. That's leading people to get the vaccination. But yeah, this is going to be a tough situation because there are going to be diehard people who do not want a vaccination. There are people who truly believe if they get this vaccine, there is now something in their body that the government is watching. I mean, I've heard it all. So, there are going to be some of those people.
Yeah, Tim, from our perspective as well, our big focus is going to be really promoting that it is safe. And if we really want our, city, county, economy, families, that is going to rely on vaccinations. So look through, through our social media, through the press or whatever, it'll be consistent messaging with, others on the business side, EDC, the chamber, and us, but really promoting the safety of the vaccines and the need for everyone to do it in order for us to get back to business.
Thank you, Marshall. Thank you, Judi.
Judi,
Yes.
just a follow-up. The staff at Lancaster General Health Campus was explaining that they're getting their doses for the day at maybe 11:30 in the morning from the pharmacy, and they have 5 hours because of the deep cold storage requirement for the Pfizer vaccine. They have 5-hour window to get all of those administered, and after that point, they're useless or wasted. And so, do you any merit to someone just kind of I don't know, I don't want to say stalking, but kind of being at a site and if there are any vaccines that people didn't show for or they're available, to be able to step in and receive it? Is that a possible route?
Yeah, so actually we do that. So there is a plan every day. For a variety of reasons, we have no shows and cancellations. Yeah. So we always have a backup list that we go through. So as soon as somebody's recognized as a no-show or we know that we have a cancellation, we're already working on that. That's also going to be part of the plan at the Mass Vaccination Center. So there will be a waiting list that's developed because all of those doses will be pre-planned. But again, we're going to have no shows or cancellations. And, we don't want to waste any drop of vaccine. So even though the center is open from 7 to 7, we know people arrive early. We need to get the day ready. We know people arrive early. We're going to have no shows and cancellations. But our last appointment is actually at 6 o'clock. And we will give vaccinations to people on the waiting list during that time too, but we're also looking at those hours between 6 and 7 that we make sure that we use up all our vaccine and we're not discarding any.
So Judi, would that mean that the people who are on the list are the ones who already had an appointment? You call them up, they come in. If somebody just happens to be driving by at 6 o'clock and they're 1B or 1C and you're only doing 1As, will they get, can they get it?
So we're still figuring out how to do that fairly, because we did have a conference call with a health system in New Jersey that's using a Sears store. And even though all of their signage clearly notes, and we all know how signs can and cannot work, but they actually get almost 200 walk-ins a day and cannot accommodate the 200 walk-ins. Mm-hmm. So we are at a mall, so we might have people at the mall like, oh my gosh, you're giving COVID injections, we want to stop. So we're still figuring out, because we want to be fair, because there will be a way with the computer software that we're using for people to be put on a waiting list. You know, obviously people that we know don't meet the 1A requirements. We would prefer for them to take our information of the phone line and how to access the website to use that, because if they're not in the 1A, because we're going to focus on the 1A requirements. I want to be clear about that because that's what we need to get through right now. But if they meet those requirements, we're still working out those details of how we're picking from the computer list and walk-ons as well, because we want to make sure that it's equal. We don't want anybody to come back to us that, we did it inappropriately. Because, like once somebody gets an injection who should not have gotten an injection, that goes like wildfire.
Yeah. Certainly.
Okay. Well, Judi, thank you very much. This has been, it's been fantastic. The amount of information. We all know how hard LG and the other medical institutions have been working towards this, but to hear it directly from you, really hits home. So I want to thank you for taking the time to do this, and thank you and thank LG for everything that you guys are doing, have done, throughout this. It has not gone unnoticed.
Great.
Don't get enough credit. So we want to give you credit where credit is due.
Well, also make sure to pass that on to Dr. Obchinsky. He has been phenomenal to work. I mean, I worked with him in the past, but this has just been a great journey to work with him and to see his passion as well. And thank you so much for having me today. I really enjoyed my time with you.
Great, thank you.
Thank you.
Good job.
So everyone, before we sign off, I believe, Dave, did you want to introduce Crystal, or is Crystal on the line?
Hey everyone, I'm here.
There she is.
Hey, good morning everyone. Do I get a quick moment to update?
Sure, go right ahead.
Okay, great. I just wanted to talk to all of you on behalf of the DID and mention that we're certainly aware of the impacts that we all experience from those who are living on the street right now, whether they're experiencing homelessness or struggling with mental health issues, substance issues. And I think all of you are aware there's a lot of things happening to address the needs that are present there with that group of people. But that work takes a long time in order for it to be deep and effective. But one of the things that we felt like as a DID that we could do immediately to help address a few things in terms of the impacts to your businesses specifically would be to increase our amount of clean team hours so that we could at least work at keeping the streets clean and picking up trash. And so we've I guess it was effective last week, Dave, correct me if I'm wrong, but effective the end of last week, we doubled the clean team hours. So took a few of the ambassador hours and moved them over to clean team. I'm fully aware this doesn't address all of the issues and we don't have time to talk about those in detail right now, but I wanted you to at least know that we're focused on working on cleanliness in the moment and that we'll have future updates related to the ways that we can all work together on addressing these problems, the impacts and the needs that exist. So that's all I wanted to say. Just wanted you to know that we're aware and we're working on the cleaning.
For those of you who don't know, Crystal Weaver is the chair of the DID board.
Thank you.
Oh, thanks, Marshall. I should have put that in my intro.
Thank you, Crystal.
Yes.
Yeah, of course.
And for those of you who don't know Crystal, she is also a resident of the downtown and a business owner, several businesses in downtown as well. So thank you very much, Crystal, and we'll keep everyone here as probably as best we can. I think several months ago, you heard from Jen Koppel from Lanco My Home on the initiatives that they were doing. We're working very closely with them and a couple other agencies to try and work around some of these situations. So it's one of those things we wanted to keep everyone here informed, and we want to continue to keep you informed as to what has been done and what is planned to be done in the future to help with this situation. So.
Thank you,
we are working with the city, the county, and other organizations to have another meeting specifically for the merchants in the next couple of weeks. So to include enforcement, social services, and again, city, DID, LCA, and others. So look for that invitation, because we do want to hear from the business community, because we know that this affects not only those that are out on the streets, but also the downtown in general, or the city in general. So we just want to make sure everyone is part of that conversation. Great. Okay, everyone, it is 9:34. Unless there's anything for the good of the order, we can adjourn until March. All right, great. Well, thanks,
Thank you.
everyone. Great to see you.
Mhm.
And we'll see you in a couple weeks.
Right. Thank you, Marshall.